All right. Welcome back, everybody, to the brain injury discussion. This is your host, Jay. Today, we're going to talk about part of the brain anatomy, which is the corpus callosum. Some might have heard of alien hand syndrome. We will talk a little bit about that as well. But let's talk about the connection between the left and the right hemispheres of the brain, and that is connected by the corpus callosum. Like always, sources will be in the description below. Always encourage people to further research and to do their own research. Also, we'd appreciate if you subscribe to the channel. We put out this information weekly. We try to keep it informative, educational, but also applicable. Uh, but with that being said, like always, we appreciate your subscriptions, likes, comments. Please give us comments and feedback. We love hearing your feedback. But with that being said, we have a lot to get into, so let's get started. So first, we need to identify what is the corpus callosum. Now, you might be thinking, Jay, that's kind of a weird word. Well, I really don't know what it translates into from Latin, but per the references, again, stat pearls, that's always a great reference. The corpus callosum is the primary commissural region of the brain consisting of white matter tracts that connects the left and right cerebral hemispheres. And so we're talking about the left and right cerebral hemispheres. They're broken up, they're split in the middle, and this is what connects those two. So think about it as, in between a border, there's a highway. This could be that highway. In between Virginia and North Carolina, there's multiple highways that go through. And think about that area or those pathways really as the metaphorical corpus callosum. And so this is how information from the left and the right and vice versa gets transmitted to the other side. So, and that's what this thing is. It's in between. And so you might be asking, Jay, what is the purpose of the corpus callosum? What is the function of this part of the brain? Per the source, again, you'll find it in the description as well as on the bottom of the slide. The primary function of the corpus callosum is to integrate and transfer information from both cerebral hemispheres. So again, cerebral, we're talking about the cerebral cortex, which is this area of the brain, or what most people would associate as the brain. We're not necessarily talking about the medulla and the cerebellum. We're talking about the cerebrum in this case. And it is to process sensory, motor, and high level cognitive signals. All right. So, in short, it transfers information to and from opposite hemispheres. So, the left and the right can communicate back and forth via the corpus callosum. And so, this is just another interesting part of anatomy. And we can go further into anatomy if you'd like. Comment down below if you have part of anatomy you want us to go into a deep dive. So what happens if the corpus callosum gets injured? This is another interesting subject. How does the corpus callosum get injured? There is a surgery, or I don't know if it's still practiced today, but there was a surgery called the corpus callostomy, which is taking this word and adding the Latin suffix to separate or to incise. Um, what they would do in this surgery, and if my source here is correct, or my memory is correct, really, is that severing this, they thought it would prevent seizures or treat seizures. And so this would separate the left and the right sides of the brain. And so someone who has that history has a brain injury because it's injured part of the anatomy of the brain, specifically the corpus callosum, via surgery. So there are some cases where, yes, surgery has caused a brain injury. And again, I'm not going to get into the details of that surgery, but if you would like me to, put that in the comments below. Other ways that the corpus callosum can be injured. Traumatic brain injury or concussions can damage the corpus callosum, especially those rotational forces. Maybe not just a direct blow, but maybe a twisting blow, something along the lines of what they call a diffuse axonal injuries, to where it's not just a direct blow, but maybe it is a rotational force. Also, stroke and or ischemia. So maybe there's oxygen starvation, either via stroke or maybe carbon monoxide poisoning. That can cause damage to the corpus callosum as well as the rest of the brain. Another one is infection or fever. And so this one's interesting because obviously fever can at some point start causing brain damage above 104 Fahrenheit of an internal temperature, and that can cause damage to these soft brain structures. Same thing goes with infection, but also toxic exposure. Toxic exposure is something that, again, per the source down here, uh, can cause damage to the corpus callosum. But one of the more interesting things, now I know it's um, multiple sclerosis and immune responses aren't necessarily brain injuries in and of themselves. They can certainly cause brain injuries. But in this case, the multiple sclerosis or the immune response that attacks and damages the corpus callosum or any part of the brain at that point, then the damaged part of the brain or the damage to the brain is a brain injury, because then it's an outside force. And it could be that there was a very heightened immune response. We do see this with these immune response or these immune disease processes where, okay, the immune system attacks itself, attacks the body. And so we could see lesions, but specifically lesions, so like damage to parts of the brain. And so in this case, not the MS itself, but what it is doing to the brain can lead to a brain injury. Usually that is diagnosed with advanced ECG or EEG techniques. And so obviously I would have to see it on paper to classify that as a brain injury, but it can certainly happen. And so this is just another way that people can get a brain injury. This is why I emphasize prevention. Although you're probably not going to be able to prevent some brain injuries like car accidents, or maybe someone who does have MS or immune diseases, they or immune conditions, they might, think about this as a way of preventing damage to the brain or controlling the immune system, not just for the rest of the body, but also the brain. And so that's why, let's be aware of some of the causes and sometimes the more common causes. This article really talked about multiple sclerosis affecting the brain. So let's continue and let's see what happens when the corpus callosum is injured. Well, first, we see what's called interhemispheric cognitive dysfunction. So that means left and right are not communicating well with each other. Uh, it's basically taking one whole brain and separating it into two halves or two sides of the cerebrum, and you're stopping that communication that's going from left to right, or maybe even slowing it down. That could show up as a cognitive dysfunction or cognitive deficit. One of the more interesting effects of having, the surgery that cuts the corpus callosum in half is this thing called alien hand syndrome. And yes, that is an actual diagnosis, post a corpus colostomy. And what would happen in this case, which I found interesting, is that the two hands, your two arms, would work independently of each other. So one is in control of one half of the brain, the other is in control of the other half. And so one might be controlled, the other might be doing other things. There's videos online of, one hand slapping the other after trying to grab an object. And so this is an interesting subject. I would love to cover it if you all would be interested in this, because there's more, possibly more brain injuries that can cause alien hand syndrome. And so that's just one of the outward or visual, something we can visualize as a outward manifestation of a brain injury. Obviously, with any brain injury that attacks, left and right side of the brain, it attacks the left and right side of the body as a whole as well. You might see what's called ataxia or apraxia. Both have to deal with movement and difficulty of movement. You might see it in medical terminology saying, okay, this person's got an ataxic gait. That means that their gait is really rough and is not normal or not within normal expectations for a baseline. So apraxia along the same ways as well. Someone who has damage to their corpus callosum might be sensitive to mild symptoms. Think about the connection between left and right and how much you have that is bilateral. You have two ears, two eyes, two nostrils, two hands, two feet. And so you might be sensitive to maybe slightly, less extreme colds, less extreme hots. You might be sensitive to one side. And so these are things that maybe we should consider. Also, because the two halves are separated, and of course we hear about left and right brain, there could be some emotional or behavioral disturbances as well. Typically, if you are left or right-sided, it depends on whether you're more analytical or more in the world of arts and science or builders or building. And so both of them, you hear right-brained and left-brained all the time. And so I'm not going to get into that exactly, but if you separate those corpus callosum, or if it's damaged, we can start seeing that manifest in their behavior as well. Disequilibrium, which is a fancy word for saying off balance. So dis being not, and equilibrium or balance. And so if the two hemispheres of the cerebrum are not connected, then it would be fair to assume that maybe there could be balance problems post having the corpus callosotomy. And so that's something that, again, can be measured. And another one that we can see is seizures. Again, seizures are common with traumatic brain injuries as well. They are common with overheating. They're also common with a bunch of other types of brain injuries. And so this is something that maybe we should think about in the world of a case manager. Okay, they've had a injury that we know of to their corpus callosum. We should maybe ask, have you had seizures? And if you do you have a seizure action plan? If not, let's work together with your doctor to make one. That way we know what to do in the case that something like that happens. And so those are some of the effects of injury to the corpus callosum. But let's talk a little bit about treatment, right? Again, there's not much that I could severely find about the treatment except for this article down here, but they noted that oxygen therapy and pain management tend to work, especially oxygen therapy, bringing those fresh oxygen to keep the brain sustained. Maybe it was an anoxic or hypoxic or loss of oxygen that caused the damage. And so this case study showed that, okay, oxygen therapy was tried and it worked. Physical and occupational therapy. Obviously, when there's something that pertains to the brain and the left and right side, you might want to, that might be a good investment there. Also, symptomatic treatment. So if something comes up, maybe there is that alien hand syndrome, maybe there needs to be a protection mechanism for that. So again, that's treating a symptom, not necessarily treating the cause, but symptomatic treatment is treating the after effects, thus needed. Another big thing is the prevention of further injury. Again, like if it's only partly injured, it's still an injury, but let's prevent further injury as well. Another one that could possibly cause, and something that might want to be monitored post a rise of intracranial pressure, is that, if the intracranial pressure causes damage to the corpus callosum, that might be something that want to get addressed. For example, hydrocephalus can cause that and cause internal pressure pushing the brain outward towards the skull. That's usually a bad thing, and so they will put in a shunt. And so that's why it's important to know these things. And of course, a lot of times, those with injured corpus callosum will be observed under an MRI, sometimes a fMRI. And that just stands for functional MRI, where it looks at the actual function of the brain, the functioning areas of the brain. So those are things that maybe we should keep in mind when we see that someone might have an injury to their corpus callosum. So what does this leave me as a brain injury case manager to conclude? Well, obviously the corpus callosum is an important part of the brain, and those brain functions connecting the, in this case, right and left sides. This is how they talk to each other. This can certainly be injured in many of the same ways we see with other brain injuries. So, if someone's got a really bad car accident and maybe they're showing some of those signs of disequilibrium, maybe alien hand, they're starting to show some signs of alien hand syndrome. Maybe this is something that maybe we can help advocate for testing for. And again, time with doctors is usually limited. So, having a case manager with you might be a great idea in this case. Injury to corpus callosum can complicate the life and treatment of the individual who sustained that injury for the survivor of such an injury. Again, like the alien hand syndrome can be quite annoying, and same with the sensitivity to mild symptoms. And so, again, this complicates life a lot, especially for someone who survived a brain injury. And so, those are things that maybe we should address, or at least see how we can address. But really, my point is let's prevent these injuries from the very start. Again, we want to be safe. There's not everything that we can prevent. Obviously, if someone's got MS, it would be important to control that before it attacks the brain, before it attacks the corpus callosum. And we also want to be observant for changes. What does that really mean in practice? That means we want to be aware that things can happen. And, if anything, we just want to observe if they're going to happen or if they're happening or if they're not happening. That kind of observation is important as well. Saying that something like that did not happen is just as important as if it does happen. So those are the kind of things that we need to think about as brain injury case managers. But with that being said, here are my references. I'd appreciate it if you like this video. Maybe leave a comment down below if there was something interesting. Maybe you want me to go into further detail on alien hand syndrome. I'd greatly appreciate your comments and feedback in the form of a like and a comment. And feel free to subscribe to the channel. We put out this information weekly. We try to keep it educational, informative, but also practical as well. And so hopefully this talks a little bit more about the corpus callosum. Hopefully this increases knowledge. But with that being said, I'm going to leave you with this message. Have a great day, and don't forget, protect your brains.